Cabinet was presented with advice today that the conditions for opening up quarantine-free travel with Australia have been met. The Director-General of Health considers the risk of transmission of COVID-19 from Australia to New Zealand to now be low, and that quarantine-free travel would be safe to commence. Cabinet accepts that advice and is confident not only in the state of Australia, but also in our own ability to manage a travel arrangement. While Queensland has recently undergone an outbreak connected to the border, this too looks contained, and Cabinet believes any residual risk can be managed with additional precautionary processes such as pre-departure testing if needed. On that basis, I can confirm that quarantine-free travel between New Zealand and Australia will commence in just under 2 weeks' time, from 11:59 p.m. Sunday, April 18th. This is an important step forward in our COVID response and represents an arrangement I do not believe we have seen in any other part of the world, that is, safely opening up international travel to another country while continuing to pursue a strategy of elimination and a commitment to keeping the virus out. But while quarantine-free travel to Australia and vice versa will start in a fortnight, it will not be what it was pre-COVID. While we absolutely wish to encourage family and friends to reunite and visitors to come and enjoy the hospitality New Zealand is ready and waiting to offer, those undertaking travel on either side of the ditch will do so under the guidance of flyer beware. People will need to plan for the possibility of having travel disrupted if there is an outbreak. But to help people plan ahead and make decisions around their travel, we want to share as much information as we can about our decision making. Just as we have our alert level settings for managing cases in New Zealand, we will also now have a framework for managing an outbreak in Australia. In many ways, we will treat Australia as a region of our own when making decisions on restrictions, albeit one with the complication of multiple internal borders. To help make that work as seamlessly as possible, our officials are already working closely together, and our health teams will be part of calls that discuss new cases that may emerge both here and in Australia. Once we know about a case in Australia, we will have 3 possible responses when it comes to flights and access to our border. And we've captured these with a framework based on continue, pause, or suspend.